Hi everyone. Well, it's a pleasure to be here today. So I'm going to talk to you about eating disorders. And unfortunately, eating disorders has the highest mortality rate of all mental illnesses. It's a really, really challenging condition. And millions every day suffer from the impact of these conditions. Now at Univa, we're trying to do something very special here. We're trying to build an actual care platform for the healthcare system. In fact, the care platform to help clinical teams better manage, monitor, and treat these conditions. In effect, we're arming these clinicians with the tools to better deliver greater access and to drive better outcomes. Now, when we think about eating disorders, sadly, every single data point is pointing in the wrong direction. More and more people, unfortunately, are experiencing eating disorders. And what's even more tragic is that the youngest and most vulnerable in our society are also experiencing more eating disorders than ever before. When we look at the 17 to 19-year-old age group, there's been almost a 16-fold increase in the prevalence of eating disorders. But what's even more worrying is actually when you look below the iceberg here, and you see actually many more young people are experiencing some form of disordered eating that could lead to an eating disorder. So really we're faced with a ticking time bomb here on the number of people that will potentially hit our healthcare systems over the next several years. But of course, more worryingly, is actually just our younger people in society are more impacted than ever before. And when we think about eating disorders from an outcomes perspective, sadly, this is a condition that has really poor outcomes. So the vast majority of people who are treated with eating disorders sadly relapse. Nearly 65% of people with an eating disorder condition after treatment do relapse. And the average treatment duration is 6 years. And as you can see here with Jackie's experience, most people turn into a revolving door patient. They come in and out of hospital. Some of those stays in hospital can last 3 to 4 months. There's many case studies out there where they're in a hospital environment for a year or more. And this is devastating both on the individual, but of course on loved ones around them. So outcomes is not great here. Access to specialized eating disorder services is also not great. And so at Univa, what we're trying to do is address these many pain points. So we're building the platform for eating disorders to license into healthcare systems. And this future perspective, or this vision perspective of the platform, is really to deliver much more personalized interventions that we're not delivering today. It's more of a one-size-fits-all approach to treating these conditions. So we're trying to pull together kind of the world's knowledge, in effect, on how to treat eating disorders, but also more in-depth, detailed understanding of that individual, so their genome, their microbiome, etc. How can we understand that individual at a greater depth that can actually allow us to deliver more personalized interventions? So we're arming the clinicians with this information, but also with tools that can actually enable them to more effectively monitor and treat these conditions. So we're reimagining actually the care experience for people with eating disorders, but not just the individual, but also the carer themselves. Eating disorders, when you, if you know someone, I'm sure many of you in the audience here today know someone who has an eating disorder, well, it actually rips apart the family. It's a devastating condition. And actually what's really important for success in treating eating disorders is actually engaging the family. And that's what we do at Univa. We're changing that care experience, not just for the patient, but for the carer and also the clinical team. So what does that look like? Well, part of that care experience is thinking about how to engage this very, very difficult group of conditions. Actually, when someone has an eating disorder, they have what's called lack of insight. They don't even realize they're ill. So they're losing weight constantly, if you've got anorexia as an example, but still they don't actually realize that they are having this condition. So it's very difficult to engage. So we have to think about lots of creative ways to connect with that individual and obviously the carer. So here we're creating actually the world's first multidisciplinary kind of virtual avatar team, because when treating eating disorders, it requires actually a range of experts. And so we're at the fingertips of these users, bringing an incredible amount of specialist knowledge that they can access 24/7 through these avatars, so they get the sense of this wraparound virtual team to support them every day. But these avatars are also used to deliver therapeutic work. But in addition, we're also thinking about how do we change that care experience when it comes to monitoring these conditions. Someone with an eating disorder, like anorexia, for example, they don't want to get physically assessed. They don't want to step on a scale. It can take a nurse 30 minutes to convince a teenager to step on that scale to get their weight. And that's a really important data point. So what we're creating at Univa is a new non-invasive way of monitoring these conditions, new digital biomarkers. So how we analyze the face, for example, and perhaps look at facial morphometry change to detect weight change. That's groundbreaking. We no longer have to step on a scale. How we can actually look at your skin complexion and understand whether you're malnourished. And these, of course, changes in our skin color that the naked eye can't see. If we can validate this, then we are changing the way we monitor these conditions and the user experience. But on top of that, we've also got to engage them with treatment and how we think about not only just the patient, we've got to think about the carer. This is something really unique about Univa, is that we're creating a real kind of home, kind of family-centric type approach. And so we're creating these really engaging ways to receive therapeutic work, but also done in a very gamified experience. We have to connect with a very challenging group. And so we're creating this kind of metaphor of growth using what's called garden biomes. So as you go through your treatment modules that week, you earn points and you get to kind of grow your garden, plant seeds and maintain it as a metaphor for, of course, personal growth. But we go further than that in the sense of this unique aspect of engaging the family and improving that dynamic between whether it's daughter and mum or daughter and dad, whoever that dynamic needs to kind of be improved. For example, if the loved one is feeling that they're not being heard, that they're feeling misunderstood, not being listened to, well, they can select a weed and the topic of that weed and send it across to their parents' garden on the carer app. And that weed is like a Japanese knotweed. It takes over their garden that week, but it triggers a module that's linked to that topic. So in this example, it triggers a module, say, of active listening and helps that then carer learn new skills alongside their current program to enhance that dynamic between their loved one and them. So Univa is about transforming eating disorder care on an international scale and to finally drive a better improvement in outcomes, reduce hospitalizations, and improve overall health of our society. Thank you.
Thanks, Rich. Such an important area. I'm just curious, how do you measure the impact of the technology? And is there a regulatory path that you have to go through in order to get to patients?
Yeah, so there's different ways we measure the effectiveness of the technology. Of course, on the monitoring side, that's about how effective is sort of scanning the face compared to traditional measures like stepping on a scale. So we have to conduct clinical studies there to evaluate that, and that takes us down a medical device kind of route for that. And then from the treatment side, then again, we think about how do we improve things like eating disorder symptoms? How do we improve, if, say, for anorexia, if they're losing half a kilogram a week, how do we change that so they're actually gaining half a kilogram a week? So we look at sort of, eating disorder behavior, symptoms, physical changes that they have, and then we use clinical studies to evaluate that, as well as pilots with, like, the NHS, for example.
Thanks, Rich. What challenges do you foresee in terms of integrating with the current healthcare systems, both here and abroad?
So, I mean, there's many different challenges. Unfortunately, there's challenges of connecting with the EHR systems. Some can be very closed as you work with them. Some can be, very open and think about the bigger picture. So we've got kind of challenges with different healthcare systems on how you integrate into EHR systems. But I think fundamentally what we all underestimate is sort of digital health entrepreneurs is the fact that we're dealing with humans at the end of the day and behavior change. And I think we underestimate the amount of effort it takes for digital solutions like ours to be adopted locally. So behavioral change is really, really important, and that's a huge barrier, whether it's for Univa or anyone else, and that's something that we have to overcome.
Yeah, super important topic. Really enjoyed the pitch. Question for me actually around the technology behind it. So obviously you can see the pooling data, patient data, global data. I was interested in the chatbot page. So if I am an individual engaging with your app, are there people behind it anywhere? Is it a chatbot? How do people respond to that? Like, are they okay with that? Have you tested that? Tell me about that.
Yeah, so we're a big believer in co-development and co-creation. So we have a lived experience group of people with eating disorders and a lived experience group of carers and also clinicians as well. So everything that we create, we We work alongside them continuously. We don't go into like a dark room for 6 months and then re-emerge and say, hey, what do you think about our product? And it just falls flat on its face. So we work in that sort of sense. Now, when it comes to the virtual avatar team, what we're using is natural language processing there to kind of create a nice kind of conversational flow from our own in-house curated content, which has been created by people with lived experience, created by clinicians, and so on. So it's validated internally, and we don't use Gen AI. Because the reason we don't use generative AI for this is because it can be very triggering. And there's been cases out there, for example, Tessa is a chatbot for eating disorders that closed down, where it was recommending to someone with anorexia to have a low-calorie diet. Now, of course, it's trained on general knowledge that low-calorie diet is normally fairly healthy for us, but that's not for someone with anorexia. So Gen AI is actually particularly dangerous in this group at this stage, and we want to kind of narrow down that risk. And so we've created our own in-house content for that chat team.
Cheers for that. Thank you. Thank you.